Shall I share my screen?
Yes, Dr. Nilesh Shah, you are very welcome to make your presentation. Thank you very much for being with us. I know you are preoccupied with the number of academic pre-assignment, but thank you very much. We are eager to hear you. Over to you, Dr. Shah.
Uh, Thank you, Dr. Srivastav. I'm very happy to be over here. And hello to Dr. Sanjay Gupta and all the members of Banaras Psychiatric Society and all the members attending this program. What I'm going to present is a model of care in medical schools, and there are various direct, indirect measures which we take in our department of psychiatry and in our medical college, that is Lokmanya Tilak Municipal Medical College and General Hospital, where I work in the psychiatry department to prevent suicide in medical students. So I will share my experience in next few minutes. So there are certain preventive measures which are unintended. It so happens that it becomes a blessing in disguise. There are intended direct measures and indirect measures which helps us in preventing suicide in our medical institute. When I talk about unintended measures, I'll be talking about type of hostel accommodation. And then when I talk about intended direct measures, so we take lecture on communication skills for UG and PG. I'll tell you about our Maitri UG group. I would like to also share my experience with happiness index in resident doctors. We have anti-ragging committee and prevention of sexual harassment committee, which also addresses variety of issues in students. And finally, there are certain indirect measures, like we have lots of recreational activities, social activities in our department and in our institute, so that there is a good interpersonal relationship, and all these activities prevents burnout. They act as a stress buster, and as a result, we feel that suicide rates are minimum in our institute, and particularly in psychiatry department. So let me start with this unintended measure, which happens to be blessing in disguise. Uh, Unfortunately, Sion Hospital had only 60 seats, and accommodation was only for 60 students. Now, gradually, number of seats increased from 60 to 100 and then 150, and now we have 200 students, undergraduate students, coming to our institute every year. Similarly, earlier, even postgraduate seats were very less, and now those postgraduate seats also have increased like anything. Earlier, we had 2 seats in psychiatry. Now we have 5 or 6 seats in psychiatry. And same thing has happened in other departments. But unfortunately, what has happened that along with increase in number of seats, increase in hostel accommodation has not taken place. So we have 2 or more students per room. Rooms are not self-contained, so the students have to use common toilets and canteen. And so everyone can observe everyone. And there is a kind of compulsory socialization. So nobody is alone. Always you have to be with someone. You can't be alone. In one room, there might be 5 or 6 people. So it is very less likely that you will be alone in your room. Toilets are common, so you have to go out and use the toilets. So again, you are with everyone. And all of them are fun-loving people, resident doctors, students. They play together, they talk together, they eat together. And that brings about a good kind of camaraderie, so that all the people are together. And because of this good environment, hostel environment, I think one of the factor is this, that reduces the suicide rate in our institute. So this is a blessing in disguise. I fully acknowledge that people should have good accommodation, hostel accommodation. At many other hospitals and other medical colleges, they have single room per person. But flip side of that is isolation. That if the person is not very social, he is little introvert, he will be isolated, and under stressful situation, there is a likelihood that he may attempt suicide. So one of the recommendations which we can make to the medical colleges or other colleges where they have hostel facilities, that preferably not to have a single accommodation, at least two in a room or three in a room works out well, and always they can choose their friends, they can choose their partners for the room. So this I thought acts as a unintended measure, which is one of the factors in preventing suicide. Coming to the other measures which are intended, we plan these measures regularly to prevent suicide. So every time when we have new students, batch of 200 undergraduate students and many postgraduate students come to each department, we have a common lecture and department-wise lecture on communication skills for UG and PG students at the beginning of the term. We tell the departments to have a friendly neighborhood psychiatry department. We tell the students about friendly neighborhood psychiatry department which is there in the institute. And we also make them aware about common psychiatric disorders. And anytime if they have any symptoms suggestive of this common psychiatric disorder, we request them that without any hesitation, they can just walk in to our OPD and we will see them. We also tell them about indicators of likely suicide attempts, and if any of them sees these indicators in their friends or colleagues, immediately they should bring it to the notice of one of us, either their seniors, their friends or colleagues, or one of the members of psychiatry department. One, we talk about winding up behavior. If the person suddenly starts giving up his books or his watch or other things, and which is seen as a winding up behavior, that now he is planning the suicide, he is preparing and he wants to give away everything, then you have to be very, very cautious. Any unusual behavior, if you see in a person, that person remains isolated, doesn't speak much, then you should immediately inform. And if he starts philosophical writing, I remember 10 years back, one student attempted suicide, and we found in her diary, she had written all these philosophical things like जिंदगी तो बेवफा है एक दिन टुकराएगी नदी एक दिन समंदर में मिल जाके खत्म हो जाती है kind of things, and which were kind of help seeking, some writing and some kind of that she had suicidal ideation. And if we come across somebody talking lots of philosophical things, then it should be brought to our notice. And also do's and don'ts when someone expresses active or passive suicidal ideations. Like we inform them that don't say just forget about it. अरे रोता क्या है, सब ठीक हो जाएगा. Don't worry, you don't have to think about suicide. Anybody who expresses suicide or passively says, I feel life is not worth living, please, please, please don't take any shortcut measures. Don't say, अरे forget about it. Don't say, अरे ऐसा you are a weak person or anything like this. You acknowledge and bring him to psychiatry department. So anytime anybody expresses active or passive suicidal ideation, please don't just ignore it. Take it seriously. Acknowledge that you have acknowledged that he has suicidal ideation, and then you please bring that person to psychiatry department. There are certain other measures like Maitri. Now we have 200 students in first MBBS who come to the Sion Hospital. We have identified 20 senior teachers of level of professor and associate professor from different departments, and each 10 students are allotted to each teacher. So 20 teachers and 10 students for each teacher. So that makes 200 students. And these teachers meet these students once in a week or once in a 15 days. They sit together, they have a cup of tea, coffee together, and the teacher discusses any problem with the student. If students are all the students, 10 students are happy, nothing to worry, just chit chat, joke around, and share your some events which have recently happened, and then uh, we disperse. But if they have any problem or they have observed any problem in any student, we kind of talk to that student, help that student. If he would like to speak to us in privacy, we take him in privacy and talk to them, and we kind of try to help that student. So we meet once in a week or 15 days, and they talk about variety of things. So one is that we can identify if the student is in distress, and also it is easy for them to approach one of us. So that barrier is taken care of. We talk about recent movies, events, studies, facilities in hostel, anything, whatever. It's a kind of free association. Everybody can talk anything. Another thing which we have introduced is what is called as happiness index. So resident doctors from each department, they are asked to rate their overall feeling of happiness, that is satisfaction of working in the department, on a scale of 1 to 10 every month. We give them a broad outline kind of thing, that if you are unhappy, you can rate 1, 2 or 3. If you are not so happy, you can rate 4, 5 or 6. And if you are happy, you can score as 7, 8 or 9 or 10. And every month we do this exercise and see where the happiness index is. And if we find that there is a sudden fall in happiness index, or if we find that one of the students have given very, very low rating, 1, 2, 3 or 4, 5, 6, we kind of call that student, speak to him confidentially, and try to resolve the problems which he or she is going through. So this happiness index concept, we do it in all the departments, and also we kind of compare that what is the average happiness index in psychiatry department, in skin department, or very heavy departments like surgery, gynec, pediatrics, uh, orthopedic department. And if we find that happiness index is very low, we request the head of the department to call the meeting of all the senior people, resident doctors, and find out why resident doctors are unhappy and what can be done about it. So this is another good way of picking up students who are in distress and preventing suicide. I told you about two committees. One is anti-ragging committee, and we have boards all around the hospital and in the college explaining the students about what anti-ragging committee is all about. And one lecture is also taken for all the students every year about anti-ragging, and all of them have to fill up one form stating that they will not indulge in ragging, and that form has to be submitted to the hospital office. So our dean is also there, and many members from different departments with their phone number. There are totally 30 members of this, where there are students, nurses, other social workers, professors, and anybody who comes across ragging can contact any of one of the members, and then we will have a meeting. We'll find out about the ragging, and the people who have indulged in ragging will be appropriately punished according to the guidelines. And this way we can kind of help the people who have to face the ragging. And after these measures, in last 5 years, we had hardly any ragging in the hospital. So I'm very happy with this anti-ragging committee and anti-ragging lectures for the students, and in case if something happens, we take very strict measures so that a message is conveyed that ragging will not be tolerated at all under any circumstances. Similarly, we have another committee which is called as Prevention of Sexual Harassment Committee. And total 19 members are there. Apart from doctors, there are male members, female members, social worker, external member, etc. And any student or any resident doctors who feels sexual harassment at workplace can come to this committee and kind of present their complaint, and we will find out that whether there is a actual sexual harassment or not, and if it is there, a very strict action will be taken against the perpetrator. He can be suspended, he can be dismissed, or any other measures can be taken depending on what this committee decides. So we have this another committee which also is very, very helpful, not only in preventing sexual harassment, but also in preventing suicide. Because sexual harassment can be one of the cause for suicide attempt. As you can see here, AIMS Faculty Association writes to the director over spate of a recent deaths. The Faculty Association of AIMS has written to the institute director to take urgent action to prevent the spate of deaths due to suicide. In the past 2 months, 2 students, one undergraduate and another postgraduate, and a medical scientist of the Apex Medical Institute of the country have killed themselves. It's a matter of serious concern. We have written to the director to collectively think and take steps to ensure such incidents are not repeated. So, suicide is not very uncommon, and we have to be very vigilant about it, and we should go all out to take all the measures to prevent suicide. Coming to indirect measures which are there in our department, I told you that to prevent burnout, to prevent grudges against each other, to have a happy environment in the department, we arrange various social activities from time to time. So here is a picture of farewell party every 6 months or every 1 year when the students have completed their 3 years of residency. We have this farewell party, and there is some theme like for this farewell party. The dress code was jeans and t-shirt. This is the logo of our department, the giraffe. It happens that my favorite animal is giraffe, so our department logo is giraffe, and everybody wears that t-shirt on the farewell party day. Another is IPL cricket match betting. Everybody wants to have fun, and majority of us are very much interested in cricket. So whenever there is a IPL cricket match or World Cup cricket match, we form a group, those who are interested in playing, and the game is all about predicting which team will win. And if your prediction is right, you get 10 points. If your prediction is wrong, you get 0 points. And depending on that, we play this game. So if there are 60 matches, we play 60 games or 40 matches every day. Everybody predicts and we get points accordingly. This also brings about a very positive environment among students and teachers. Everybody plays. And then the person who wins gets some prize. We have this concept of annual picnic. Every year, all the members of the department, not only resident doctors, not only faculty senior members, but also the staff, ward boys, sweepers, ayabais, nurses, everybody, we all go for an annual picnic. Usually it's in the month of January or February where the weather is good, and we hire a bus of 35 people, and 35 of us go to some resort and we enjoy together. Here there is no difference of seniority, juniority. everybody's together, everybody plays games together, goes to swimming pool together, and we all enjoy. This improves the interpersonal relationship, and finally, uh, that culminates in the good environment. And this is an indirect measure which we take for prevention of suicide. Here, another thing is during Navratri festival. You all know in India, we have 9 days of Navratri, and there is a dress code for each day. So one day everybody has to wear pink, another day everybody has to wear blue clothes. Similarly, so we all follow that and take the pictures and put it on the group, inform other department also that what we have done, and everybody enjoys together, wears all same kind of clothes, same color of clothes. And this also I have found improves the relationship amongst the resident doctors and faculty members, and helps in preventing suicide. We regularly have CME programs in our department, and one of us only take a lecture whenever there is a new molecule which is launched, or whenever there is something new concept which has come, new article which has come. We have this CME program from time to time, sometimes once a week, sometimes once in 2 weeks, kind of thing. And then everybody presents their cases in there, everybody discusses together, and this also becomes learning activity, and also a very good socialization occurs during these programs. Once we also had a fashion show. The residents said we will have a fashion show, and we all enjoy together, senior, juniors, resident doctors, senior faculty members. And these kind of activities reduces the distance between resident doctors and senior faculty member, and residents feel very good. They can easily approach. Rapport is established well, and anytime any resident has any problem, they are not afraid of coming to the doctor. They come to us directly and spell out their problems, whatever the problems they are facing. Similarly, Diwali Puja we do every year. Again, it's a festival. So one of the things which we do is celebrate all the festivals of India in our department together. So department is like a family, and right from day one, where the resident doctors join the department, we tell them that we are all members of the family, we are all family together, and you don't have to miss your family. We are the families, and we celebrate all the festivals together. So these are the measures which we take, uh, certain unintended measures, certain direct measures, and these are some of the indirect measures, like celebration of birthday party. Everybody has a birthday, and on that day we get the cake, we cut the cake, we eat the cake together, and wish, sing happy birthday song for the birthday boy or birthday girl. And similarly, in Christmas also, as I said, we celebrate all the festivals together. We have this game called Secret Santa. Most of you are aware about Secret Santa. So everybody gives gift to another person. So I become the Santa for somebody who doesn't know that who is his Santa. So finally, these are the measures: unintended measures, direct measures, indirect measures. Basically, all these measures improve the working environment of the department, working environment of the hospital, and people are under less stress. If there is a problem, they can easily approach to the senior faculty members, and we take care of their problems. Easy solution, easy resolution of the problem. So luckily with these measures, we have minimum suicide rates in our hospital. I don't remember anybody who has died of suicide in last 5 years in our hospital. So I hope, I'm very sure that in other hospitals, other department also, you must be having similar measures. And I think these measures are very, very important to have a healthy environment in the department, which ultimately helps in preventing suicide. So thank you very much. And I end my lecture over here and I hand over the mic to Dr. Srivastav again for his comments.
Thank you, Professor Shah. In fact, you lived up to my request. I really wanted this experiment to be narrated, that how human relations, closeness, interpersonal relationship, communication, knowing each other are not simple things. They are very complex situations, but the measures to correct them are simple. They form part of our day-to-day life. We can have master program, super master program, but unless we integrate them in the lifestyle of each and every student, our attempt to deal with problem of suicide ideation and suicide attempt in students cannot be really sorted out. So, Dr. Shah, thank you very much. I wish you were available for discussion, but I will take forward any questions or queries and discuss with you and come back to the panel. Maybe at the end of the day, I will try and connect with you. Thank you very much. I much appreciate your support.
Thank you very much, sir, for this opportunity.